Good afternoon, Lisa Homa here. Hope you're all having a great day. Today we're going to be talking about community issues and emergencies. We're going to be talking all about prevention and control of disasters. The objectives of this lecture are to talk about prevention and control of disasters. On to Chapter 10. What is a disaster? It's a sudden or serious event of such a scale that there is considerable human property or environmental damage or loss, with resultant serious breakdowns or disruptions in community or societal
2
functioning.
hours later.
What a mouthful! It requires exceptional efforts or outside resources for management and recovery. There are two types of disasters that we typically think of. They're natural disasters, things like earthquakes, tornadoes, volcanoes, wildfires, mudslides, hurricanes, and droughts. Or man-made things such as, let's say there's a chemical spill or an explosion or oil leaked into the ocean, or nuclear or something radiologic like 3 Mile Island disaster, or acts of conflict or war or terroristic acts. Or we could have things such as a healthcare organization emergency. What if the power went out to a healthcare facility and all the ventilators went down? Or what if there's overwhelming flooding that we couldn't use our equipment, we couldn't have the operating room running, or something of that nature? Overwhelming volume of patients from mass casualties, or patients requiring special care, like initially when COVID first hit. We didn't have enough ventilators or enough equipment to manage the types of patients that were coming in all at one time. We're going to work on two areas of disaster management for the NURS, prevention of the community's disasters, so we're going to start there first. And I want to mention that Healthy People 2030 reaffirmed its commitment to preventing and controlling disasters. Things we think about that a population health nurse could monitor on the prevention side is keeping up with, let's say we're talking about a man-made disaster. That would mean that we want to be sure that our facilities are in compliance with their inspections, that they don't leave their equipment get faulty, and they don't keep up with things like that could place the people within that area at risk. We want to make sure we prevent natural disasters. Things that we can do, we can't do a lot to prevent a tornado or hurricane, but we sure can put in warning systems to help alert people that those types of activities are coming. We can also work on building volunteers so that they know when to go into action within a community if these things hit. Like if you're in a hurricane kind of driven society, you should have volunteers to help make sure that people get out okay, that they know where the evacuation routes are. Your emergency service teams should have a fundamental understanding of how to manage those types of situations. You want to seek volunteer pools and make sure that you have them ready, and make sure everyone is trained so that you have disaster drills when all these plans go into action in a real situation that people have gone through it at least one time and it looks somewhat familiar. Agencies that we use to work on community disasters commonly, the Red Cross, this is what they do. This is where they shine. FEMA, U.S. Department of Homeland Security is known for its disaster relief. Disaster plans should be made simple, clear, realistic, flexible, and easy to implement regardless of the nature and the extent of the disaster, whoever is implementing the plan. The idea is that it could be taken over by anyone at any given point in time. The disaster paradigm. The disaster paradigm is a sequence of responses in order to respond appropriately to a disaster. During the detect phase, is the cause unknown? Is the emergency a public health emergency? For example, if it were like a nuclear disaster, would the public need to also evacuate, or are there other people who have to be evacuated? Part of the detection phase is also creating an incident command. So, should emergency response or emergency management be activated? Who's in charge of the scene? Who is the incident commander? Those types of issues need to be addressed pretty quickly. You also want to make sure that the scene is safe. Whenever a disaster occurs, the scene is considered unsafe until proven otherwise. So once that has been established, you can create the command. So the next part, scene security and safety, that's all part of with the detection. And then assessing for hazards. If this is a chemical plant or if there are still gaseous particles in the air, you can't be there. And as far as support, what personnel, equipment, or supplies may be needed for the disaster that you're managing? Depending on the situation, do you need special agencies involved? Do you need certain vehicles or equipment? This phase of it is triage and treatment. We're going to spend a little bit of time talking about how to manage injuries and how to tag and prioritize. I know that sounds so insensitive and not personal, but it's a way of dealing with with mass casualties if that happens to be what you're managing. It's the triage tagging, and it goes by the acronym START. START stands for Simple, Triage, and Rapid Treatment. So if we have people who have minor injuries, they get a green tag, and that's people that could wait for care up to about 3 hours. If they can manage delayed care even more, they are urgent, but they could be delayed up to an hour. You want to make sure they get tagged with a yellow. And red, they get the life-threatening, they need immediate care, they cannot be pushed off for any significant period of time. And a black tag would be the person is already dead or very close to it, and nothing that you could do to intervene is going to help them at that point. The START process is created. Make sure you have a designated safe space for the injured. So you have to first establish a safe place. Then you want to be able to get the people that can move themselves to get to that designated area. They need to go next. Then you want to take the people who are unable to move themselves, allotted at 60 seconds or less per patient, assessing and designated the patient. And this is where the general categorization and tagging occurs. And you can get a simple sense of what their treatment needs would be. Triage is an ongoing process. The most seriously injured need to be checked as often as resources and time allow. Evacuation and transport of victims and casualties. So how many people are we talking about are going to need to be evacuated and transport? Those are all things that the incident commander needs to know and needs to convey to other supporting agencies. And in what order and what type should those patients be removed? Evacuation indicates removal of both the injured and the uninjured to a safe environment. So the triage color is actually what dictates who gets transported first, right? So the most critical, they get transported out to health systems first, and then you take them by color. So it would be, well, black, I guess, doesn't matter. They can wait till the end because they're not alive. So it would be red, then yellow, then green, and then you would work on getting the black tags out last. In mass casualty situations, we also need to have an ambulance, and you have to be thinking about have one ambulance for every 5 patients approximately. So just to give you some idea how to triage that appropriately. If possible, use your community resources to help get the injured to the hospital if you're talking about mass casualties. And that would be using school buses, city buses, boats, trailers, planes, helicopters, having citizens use private cars, whatever they could do, any spared emergency vehicle that they can use it to transport victims. Reduce risk and recovery. Reduce further exposure if possible to the hazardous chemicals or whatever the emergency is. So what are the immediate needs? You want to focus on saving as many lives as possible. After all those issues have been addressed, you want to work on the recovery phase. So what are the needs several days after the incident? And what are the long-term needs to this community who's been likely devastated by the recent event? So nursing skills and disaster preparedness. For example, does this community have a chemical plant? So things that we can do in the prevention phases. What if the chemicals that they use at that plant require decontamination training for healthcare teams? That would be something that a community health nurse could start to implement. Other disaster preparedness on this phase, there are 4 stages to it. Stage 1 is prevention. That's where we identify the vulnerabilities of the community and plan preventative trainings and early warning systems. Stage 2 is prevention in action. So it's implementing community disaster education. That's evaluating and updating current policies and procedures to support the new interventions that you want to implement if a disaster occurs. Develop cooperative agreements like we'll take X amount of patients, will this hospital take 50 patients, what's the capacity of the health centers where you are? And then gain volunteers. You want disaster relief helpers, people that you can count on will move right into action as things happen. And then, of course, have drills to practice at least annually. Stage 3 of the response phase, that's where we're managing. You're actually responding to this minute-to-minute happenings of the event. Stage 4 is recovery, where you look at long-term in the several days, weeks, and months following the event. What can you do to restore the area if possible? Could there be rebuilding? Is there rehabilitation needed? And you want to evaluate, how was your response? How did your teams do in stage 1, 2, and 3? And can we do better in the future? And what does that look like? And then managing community disease. I think we're pretty saturated with that with COVID, and that's an ongoing thing. I feel like we've learned so much as a country, and our health systems have learned so much that I think this is going to change significantly how we have viewed things a year ago. So I'm going to move through this phase. I think we're super saturated in this area, and that's all I have on that. Thanks so much for listening. Have a great rest of your day.